So when you have these patients, these walk-in patients, and you're suspicious of the fact that they might be suffering from any kind of an underlying pathology that is related to the growth hormone, specifically you're suspecting acromegaly in the patients, you can be basically inspecting the facial features and obviously then move on with the vital signs. The general physical examination is very crucial over here because there are a lot of systemic conditions. For instance, they can be suffering from hypertension, diabetes, and that can affect the overall vitals of the individual as well. Then we move on with the systemic examination of the individual. We are going to rule out the features. We are going to note down the blood pressure for the individual because sometimes acromegalic patients are also suffering from the secondary conditions such as hypertension, diabetes. They have the complications related to ischemic heart diseases, and all of these basically give you an overall picture that is related to the acromegalic condition that is developing in the patient. So obviously, starting off with the history is very important. You'd be focusing on the complaints that the patient has. The history of presenting illness is very important over here, because that is going to highlight whether the patient had this particular problem since childhood or he or she has recently developed this condition. Because we're going to basically distinguish between these two conditions, that is gigantism on one hand, and then we have acromegaly on the other hand. So ruling out, getting the details from the past history as well as family history is again very important, because genetics really play a very pivotal role in the development of the acromegalic condition. But obviously, certain conditions, for instance, if we are dealing with an adenomatous condition, if we are dealing with a metastatic carcinoma, which is indirectly responsible for the spread of the growth hormone in the individual, then it can be an isolated condition. Sometimes the patient won't even give you a family history or even a positive past history, past medical or surgical history is noted down, as we even saw in our particular case study that we were discussing. There was no positive family history, no past medical history, and no significant drug history as well. So you basically are going to investigate the patient in detail and know what are the etiologies or the pathological factors over here. So having the patients of pituitary gigantism, we'd be looking at the features of height, stature. The body habitus is noted down in detail. Apart from the facial features, you're also going to look for the photographic evidence if it can be provided at that particular time or even later on for the reference, of course, that you're going to basically have a comparative study regarding the stature size that has been increased, or it can be an increase in the size of the hands and the feet as well. Mandible prognathism is one of the phenomena that is seen, and you're going to look for all of these features in detail. Inspection is the key over here. Having a close inspection, having a collateral history from the friends or from the relatives can also be very helpful for these in these particular cases. Now, the acral bony growth is found at the joints, and usually it is affecting the toe and or either it can be the thumbs. So usually you have these joint deformities. Again, the growth hormone is acting upon the epiphyseal plates, and it is basically giving you a picture of this acral bony growth in the individual. Frontal bossing is noted down in the individuals, and basically you have these frontal prominences that are usually present in the individual, but if it exceeds, and obviously distinguishing between a normal and an abnormal phenomena is very important, and that only comes along when you practice, and basically the inspection in a very close manner is very important over here, and that is how you can basically distinguish over here the prominences, as even shown in this particular picture. It's basically the frontal bone has these normal prominences that are basically aggravated in cases of an acromegalic patient. increase in the hand and the foot size. So as we even saw in our case study that the patient came up with the peculiar complaint that he had basically had an increase in the shoe size. And that is how he basically noticed that there was something wrong and there was an undergoing pathology that basically brought him to the clinic. So this is one of the key feature that can be quite distinguishing. Then we have the mandibular enlargement, which is seen in these patients. So you usually observe when you ask the patient to open the mouth, and you usually ask and you usually closely see for the gum excisions, and that is basically that is how basically you're going to diagnose that the patient has the mandibular enlargement or not. Prognathism is basically the forward protrusion of the jaw. That is the normally we have a retracted jaw, and whenever there is a forward protrusion, and that is a sustained protrusion that is seen in these patients, that is known as prognathism, and this is one of the key features in patients of acromegaly. Now, when you look at the space between the lower incisors, there is a widened space that is seen in these patients, and that is quite diagnostic for these patients as well. The clinical features are suggestive of the soft tissue swelling. We have an increased heel pad thickness. So apart from the thickness in the skin, which is known as acanthosis nigricans, which can be pigmented or not, it can be an increased heel pad thickness as well. It can be an increased shoe or glove size. Again, basically the increase in the hand and the foot size is going to result in this particular phenomena. Ring tightening, or it can be carpal tunnel syndrome. So we have the tendons that are attached at our wrists, and whenever we have an inflammation in those tendons, it results in the ring tightening, and it results in a very painful phenomena at the wrist, which this condition is basically known as the carpal tunnel syndrome. Characteristic coarse facial features due to this endocrinal abnormality, large fleshy nose. So basically all of these features are collectively going to contribute towards the diagnostic factors. The bone growth is noted down, and you look for all of these features. The facial features have to be in symmetry, and if there is any asymmetry noted down, you can go into the details and you can investigate whether it's a physiological phenomena or whether there is any undergoing pathology that is contributing towards the development of all of these features. Now, the other clinical features, they include the hyperhidrosis. We have the deep and hollow sounding of voice, oily skin. Hyperhidrosis is basically an increased sweating phenomena that is seen in the individuals. Arthropathy is also noted down. Then we have kyphosis. Basically, the spine deformities, either scoliosis or kyphosis, is noted down. Carpal tunnel syndrome due to the ring tightening is one of the key feature. And then we have the proximal muscle weakness and fatigue. Acanthosis nigricans, that is basically the thickness of the skin is increased and it can be pigmented, and that is basically known as the acanthosis nigricans. Skin tags are commonly seen for these patients, and generalized visceromegaly, or increased in the size of the viscera. It can be the liver, the kidney, the heart. Cardiomegaly is noted down. All of these are seen in these particular patients. Possible complications include the cardiovascular system that can be involved, and particularly we have hypertension that is seen in the patients. We have the ischemic cardiac diseases that are also noted down for these patients, and then we have hypertrophy of the heart resulting in the cardiomegaly, decreased diastolic functions. As we even saw, the ejection fraction was affected in our case study. It was almost reduced. Hypertension is seen in the patients, and upper airway obstruction with sleep apnea. Diabetes mellitus was noted down. and increased risk of colon polyps. So all of these can be the complications, and it can basically overlap the normal clinical picture of the individual, which we have already studied. These are basically these complications, if any one of them are found, they're basically indicating the fact that the patient's condition has worsened with the passage of time.